Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Right, Christopher, tell me what's going on with your right foot.
I've had an ongoing pain in my right foot.
Okay.
Underneath the right outer heel
Okay.
area.
How much pain do you feel there from 0 to 10?
If I twist my foot out, it's 7 or 8 out of 10.
Where do you feel it?
The pain is right in here.
Right in there. So when you twist it out, what about the standing or walking? Do you have issue with that?
At times I do. So standing like that.
How much pain?
Maybe like about 3.
3. Okay.
Barefoot.
If we want to aggravate it, how we aggravate it?
If I wore my shoes, it's more aggravated.
More aggravated?
Yeah.
Okay. So, all right, we have to work on it, so we'll do that afterward. So, can you give me a little bit history about how long this has been going on? How did you heard it?
Been ongoing for about, I would say, 6 weeks.
6 weeks. Okay. And how did you hurt your ankle?
I was on about an hour and a half walk.
Okay.
Towards the Venice Beach area. I was out with a friend walking around for a long time.
Okay. And you start to feel pain there. So I see you have like a boot there. Just briefly go what's going on with that. Is that like when you start to have pain on the side or before the boot or after the boot?
This was happening before the boot.
Okay. So, but we were focusing on the right side. So can you tell me like, it's 8 weeks you said? How long?
Well, this has been for 6 weeks.
For 6 weeks.
Yep.
So can you tell me like what kind of treatment you had on this ankle?
I've had some massage therapy.
Okay.
I've had some cold packs and some massage. Not much.
Okay. So let's actually try to do this. I want you to stand and put more weight on this side and tell me how you feel, like pain-wise, because I want to see 0 to 10. So you're technically standing on that foot.
Right.
Okay. How much pain?
Right now it's about maybe like 2 or 3.
Okay. Let's walk a few steps and tell me how that feels.
So that's more painful.
How much?
That's more like 3 or 4 or 5.
So walking is more
Walking
pain.
is more painful.
Okay.
Yeah.
And it's all in that spot.
Yep.
Any pain anywhere?
No.
Okay. So you can have a seat and we'll actually work on it. Make sure whatever I'm doing is careful, okay?
Yeah.
Okay. So relax. You can no, just sitting up, the same position. Right. Okay. Relax. This is the spot. Right in here?
A little bit lower.
In here?
Yep.
Okay. Is this usually was like swelling like this, or is that something new?
The swelling I think is more recent. Yeah.
Recent? Okay. How does it feel?
It's fine.
Okay. Let's just scoot a little bit forward. So the pain increase with long walk or it's just the same?
Long walk.
Long walks start to increase, and you said at worst how much?
Right.
How much at worst? How much pain do you feel?
Probably like a 9 or 10.
10. So yeah, as long
When that happened. Yeah.
Yeah, how long is a long walk? Is 5 minutes, 10
Like
minutes?
an hour.
An hour, and you start to feel that.
Yeah. Hour and a half.
Okay. So I want to make sure you really wear a wide shoes,
Right.
so you don't compress.
What about the arch support?
Yeah.
I do have some arch supports I can
Is
put
it
in.
soft or hard?
It's hard.
Yeah, want
It's
to make
more
sure.
hard.
Bring it with you next time. I want to
Like
take a look
good
at
feet,
it.
like the Good Feet store.
Just bring it
Oh,
with
yeah.
you. Yeah, so I want to see it.
Okay.
Yeah, and bring like a white shoes, like, so I will be able to look at it to make sure. But when you shop for shoes, make sure it's white.
Yeah, that's
So
the
you're not
size.
compressing. Yeah.
Yeah,
And
these are
then-
more narrow, but the other ones are
Yeah,
brand new. They're
that's not the
wider.
best. And make sure it's really not flabby things, just supportive. Those like clothes that's really not supportive. Like this. Look at here. It's a
Right.
supportive. It's not like
Okay.
material that's not supportive.
Right.
You know what I mean? For stability. Yeah.
Okay.
So, and when you go buy your shoes, you have orthotic. I'm not sure it's the best orthotic for you, but when you buy shoes and you wear orthotic, make sure you take your orthotic to fit it in the new shoes
Oh, okay.
to make sure it's really fitting.
Right.
Okay.
I
So
understand.
it's not it does not make your feet tight.
Right.
Okay. Do you feel you're rolling your feet more on the outside?
I can see that now.
Yeah, that's
I
probably.
can see where the pain is
Yeah,
starting.
yeah. If you start to roll it
And
out.
anytime I twist it like
Yeah.
that, it hurts.
Yeah, and if you notice when you walk, your weight more here, that's will cause issue. We want to make sure your weight in 3 points,
Mhm.
and in your heel,
Right.
here this area, and here, and even like so. If your weight more on the outside, that's not a good sign.
Right.
If your weight here, we need to really figure out why. Is it a structure, or we need to
Mhm.
work on something else.
Right.
Relax. Make sure that's not too much, okay? Any pain down or just all on the side here?
It's all
Okay.
pretty much on the side.
So it's gonna feel cold. I'm gonna work on breaking the scar tissue. Make sure that it's not painful, okay?
Yeah.
So, wow. Well, we dropped a little bit more. You feel this one here?
Yeah.
That's a scar tissue. You feel that here?
Yep.
Here is okay actually. Feel the difference? How nice and smooth here.
Right.
Smooth here. compared
It's
to
always
this.
been on the side of my shin.
That's
where
you feel.
I feel the most tightness. and
Tightness. You feel tightness here.
difficulty.
Yeah. And you feel here. That's the start to have the scar tissue that's growing.
Yeah.
Here.
Does massage therapy help anything?
So
Or not so much?
it's technically it's hard to break a scar tissue with the hand.
Mm-hmm.
And if the therapist try to break it with the hand, it's either they help you or hurt themselves.
Mm.
It does not work both way.
Okay.
So if they really, and it's hard with the hand to break a scar tissue. That's why I designed this tool to really get there without hurting my hand. Because if
Right.
I do that too much, I'm gonna have arthritis in the hand.
Sure.
Nobody gonna do that.
Or carpal tunnel.
Or carpal tunnel.
Yeah.
And I see a lot of massage therapists. I see them for carpal tunnel, trigger finger, because they use their hand a lot.
Mm-hmm.
So, and if you go too deep, you're missing the superficial layer. And how are you gonna do the superficial layer with your fingers? You gonna do this? Who's gonna do this for like 5 minutes?
Yeah.
you know. So and are they gonna massage this area? No, they massage soft tissue.
Yeah.
So they so based on the studies, actually there's 3 systematic review. It shows massage provide temporary result. There's no long term, and it does not
Mhm.
transition to function.
Right.
So, and systematic reviews, they usually look at, you know, some of them we look at hundreds of studies to come to that conclusion.
Mm.
Is that too much?
No.
Yeah, so, but I have a lot of massage therapists, they just use this tool to save their hand, you know.
Right.
Because the lifespan of the massage therapist, if they work full time, they usually 5 years, and after that it's just not easy on their body.
Right.
Hmm. Too much here,
No, it's fine.
and you can see some redness here. Where is this scar tissue?
Right.
So this is a spot here, and you said around here or just in this spot? This is a spot. Relax.
Yeah.
You see your shoes is tight here, or you put more weight here. You see the redness?
Yep.
Start to have buttons here. So that's a sign that either your shoes too tight.
Or off
Yeah.
balance.
Yeah. So when you see redness like this,
Yeah.
something like this in the shoes, that's a red flag that something is not right.
Yeah. And I'm overweight right now beyond
Mm-hmm.
the way I should be right now, so it's creating
Relax.
a lot of stress.
Relax. Yeah. And you know, if you want to work on that, we can work on it. So let me know if that's too much. Is that too much here?
No.
Mm. Is that swelling since this happened, or you had that swelling before? This ankle here.
That's more recent.
More recent?
Yeah, they gave me naproxen
Naproxen? Yeah.
to
Mm-hmm.
deal with the healing or
Mm-hmm.
the issues of inflammation.
Did it work?
It does to a certain degree, but I don't find that it's 100%.
Mm-hmm.
And they tested to see if I had gout,
Mm-hmm.
which I don't have, and I do
Was
have
this swelling?
borderline.
Or you
Yeah.
had swelling anywhere
At
else?
the urgent care, they said, "Oh, we'll test you for gout," because they thought maybe that was associated with gout. It's an injury. It's a foot injury.
That's new. Okay.
So, but it's
Mhm.
negative on both.
Okay.
I'm a little bit borderline diabetic right now. And
Oh, okay. Mm-hmm.
I get my weight down.
Mm-hmm. Are you working on that?
But yeah, I'm
Mhm.
going to some classes, and I'm trying to do a keto
Mm-hmm. Good. Yeah.
type of diet, which
I will give you a good tips, okay?
Yeah.
After we finish with this.
My
to help.
nutritionist at
You work
the
with
other
that,
medical
that's
center,
good. Yeah. Mm-hmm.
says, "Oh, that's a fad diet." It's like, not really. It's an old diet.
Mm-hmm.
It's ancient.
Oh yeah, this is the ketogenic. It's like
Everybody wants me to do the low fat thing. It's like fats.
mm?
Certain fats are good for you, and that's the
Yeah.
problem.
When we look at our ancestor,
Yeah.
their diet was fat.
Yeah.
That is the most efficient source of energy.
Right.
It's
Instead of
fat.
sugar. No
Sugar is that's introduced during the industrial.
Yeah. Right.
Introduced during the industrialization, but at the time we have a lot of high blood pressure, diabetic, overweight. That's with the high carb diet.
Right.
Yeah, because carb actually convert to fat.
Exactly.
Fat actually burn fat.
Right.
People do not realize that.
Well, they
Because
don't want to.
It's all the same. It sounds the same, fat and fat.
Yeah.
But it's work this way.
Right.
You know. So yeah, I've been on.
Yeah.
Well, I did some modification to the ketogenic diet, but I've been on it
Okay.
for a year and a half, and I feel better with that.
Yeah.
Okay. So I mean,
Well, it definitely feels more relaxed.
you feel
right
it?
now.
Okay.
Yep.
And you can see the scar tissue with redness. You
Okay.
can see those redness around here and here.
Yep.
It's a lot of scar tissue. So let's actually, one second. Okay, so let's stand up and tell me how that feel. 0 to 10.
Right now, it's about 2.
Where?
Maybe on the side of my foot.
Okay, point it exactly where it is. Okay.
Let's see, what's that? For the most part, it's gone, but this is the only part that's hurting.
That spot or the lateral part?
That's a particular spot.
That particular spot.
Yeah.
And that's, you said 2?
Yep.
Okay, so
That's the
let's,
most.
alright, so let's actually, I will have you have a seat again. We'll do a couple of more things. Did you have any injury there before? Let's
Not
put
that
your
I know
legs
of.
down.
Yeah.
Okay. You can sit up. Right, so you have not sprained your ankle before?
No.
Okay.
Maybe as a kid, but
Mhm.
maybe a long time ago.
It's right in
I
this
just don't
spot, yeah?
remember. Yeah.
Right in here, yeah?
Maybe a little bit lower. Ooh, yeah.
Here, that's, you
Yeah.
feel that? Okay.
Oh, yeah.
Is it too much for me doing? It's okay.
No, it's fine. Ooh, yeah.
Sorry, so,
Yeah.
okay. Alright, so. I'm interested. Do you have the same, like, swelling here on the other side, or I'm not sure?
Well, there's usually like a little,
It's
when
like a
I
fat
move my
pad
feet
here.
around, there's always been like a thing that sticks out like that.
It's always been like that.
Kind of like that,
Both
yeah.
sides, yeah.
Both sides.
So that's genetic, okay.
But the
It's
part,
not new.
but the part below it was where it was swollen. Like
This
from
is,
here all the way down to
Okay.
here,
Okay. Relax.
if that makes sense.
Yeah. Is this the area?
I'm sorry.
You feel my hand?
Yeah, I do.
That's like
it's
on
not as
the scar
painful.
tissue?
Close to it, yeah.
Is it the area or just in here?
I think it's in there.
This one? That's
Yeah.
where you feel that
But I don't
grinding here?
feel, yeah, I do.
You hear that grinding? Okay.
Yeah.
Let me know if this too much, okay? That's a scar
Okay.
tissue here actually in that spot. Is that too much?
No.
Okay. So you really probably
yeah.
compensate a lot rolling your feet out like probably or this way, putting more weight on it.
Right.
So you get like a micro strain here and you start to have scar tissue in this area. Too much
Yeah.
service. Okay.
Yeah, I can,
You feel
Yeah.
the scar tissue, yeah?
I can feel the vibration
Yeah.
when you go over the.
The scar
Tissues.
tissue. The
Yeah.
scar tissue, that's a vibration because if you
Yeah.
don't have a scar tissue, it should feel like nice and smooth, like
Right.
going smooth.
Yep.
So, yeah,
You
it's
got
easy.
the right area.
It's easy to feel it with the. Okay, let's walk a few steps and tell me how that feels.
Feels a whole lot better.
Any pain or it's 0 to 10?
No, 0.
Mm-hmm.
Yep.
Have you stand on it a little bit, just a second, and see how that feel. We try to do more than before to see how that's responding.
Right.
It's good, yeah. How you single leg stand here? Look at that. It's nice. Yeah. How's that?
Much better.
Much better. Okay.
Yeah.
So, what do you think about ASTR treatment?
Impressive.
Yeah. Thank you. Yeah, I'm glad you're feeling better. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.